Hey, Balance Babes. All right, we are in part 3 of the series of low testosterone in women. So we've talked about the signs and symptoms, we've talked about the causes, we've talked about testing. Now let's talk about what the heck can we do about it. So let's talk treatment options, okay? So first thing to know is that treatment is totally personal to you. So what might be working for your friend that has low testosterone, or your other friend that is doing this kind of treatment therapy for her low testosterone, whatever might be working for them might not work for you at all. It could make you a crazy person. It could make you feel even crazier than you're already feeling right now from having your low testosterone, okay? So try to keep your earmuffs on. Don't let people get into your head and talk to you about what they are doing and what you should or shouldn't do, okay? Treatment is going to be very specific to you and the balance between all your other sex hormones, as well as your thyroid, as well as your own lifestyle. So what works for somebody else might not work for you, but when you find what works for you, it's really gonna work great, okay? So here are some things to consider. So lifestyle changes first and foremost, okay? No matter what treatment option you decide to go with, if you don't have the anti-inflammatory diet, if you're not doing the regular strength training, you're not managing your stress, you're barely sleeping, you're never going to get a healthy testosterone level, okay? So use that foundation, use the balance tracker for all those daily healthy habits to make sure that you have the foundation, you have these things on lock. They sound super simple, but they're super, super powerful, and just doing them alone can increase your testosterone, okay? So just sleeping for 7 to 8 hours per night for a consistent period of time can increase your testosterone. So if you do have a low testosterone, first and foremost, before you decide to do any sort of treatment, you need to make sure you have the foundations. Next thing, supplements. So things like vitamin D, which is actually a hormone, zinc, magnesium, they can help support healthy testosterone levels. Other things like adaptogens like ashwagandha to help reduce your stress levels, to help you calm down and sleep better. Those could also reduce the stress and balance out that testosterone level. Even something like DHEA, which is a precursor to testosterone, it can be a solid treatment for many. I do have people that I've worked with a low testosterone. They just needed to hop on a low dose DHEA supplement on a daily basis, and their testosterone levels are out of the tank, and their symptoms are minimized, and it works great for them. Okay, the third thing that we need to consider, hormone replacement therapy. So there is medical treatment where testosterone is supplemented to bring your levels back into balance. It's definitely something that you need to speak with your healthcare professional and have them monitoring your testosterone levels, as well as all of your other levels, your other sex hormones, as well as your thyroid, your liver enzymes. Hormone replacement works great for a lot of people, but again, it is going to be specific for you, and it does need to be monitored. There's tons of options out there that are creams and patches. There are even things now called pellets that are tiny, tiny little pellet-looking things that are inserted subcutaneously into your tush, essentially, in the meat of your tush, and it absorbs over 90 days and just helps bring those levels up. It's bioidentical to what your body makes itself, and a lot of people respond really well to that. The last treatment option, herbal and natural remedies. There's a lot of different science out there showing things like fenugreek or maca root. They can increase testosterone production, but again, definitely consult with a healthcare professional. Herbs are powerful and in a great way, but can also be extremely powerful in a scary way, okay? You need to make sure that these herbs are not going to interact with any medications that you're on, with any conditions you might have. Herbs can work fantastic. I myself are on a ton of herbs, and I don't know what I would do without them. But again, they can be powerful in a way that can be dangerous. So always make sure to consult a healthcare or wellness professional. Okay, so there's no one size fits all with the whole low testosterone situation. So no matter what route you take, remember that you are in control of your health. Okay. If you are having symptoms, if you know you don't feel good and you know you want to feel better, please don't just take, it's just you getting older, or please just don't let the doctor not listen to you. Make sure you find a healthcare professional that is going to hear you, that is going to understand what you're going through, that's going to get you the proper testing that you need so that you can make the right decision on treatment and you can start feeling your very best, okay? One step at a time, but please don't let no just be the answer if you're truly not feeling good. Keep digging deeper. Reach out to myself for help, or reach out to myself for a referral to where you can find that help. You don't need to just not feel your best, and I don't want that for you guys, okay? So if you have any questions or you want to dive deeper into this topic, feel free to reach out to me, of course, or book a one-on-one consultation. I am here to help, and I hope you guys enjoyed this 3-part series, and let me know if there are any other specific topics you guys want to talk about. Women's health with hormones, gut health, inflammation, whatever it might be. Reach out, give me some ideas. I love to talk about it. Have a great day. Bye.